Page number 720, First Aid 2022, Section 3, Rapid Review, Classic Labs or Finding. This is the some one-liner in the first aid, the classic labs and or finding. Some of the labs findings and the possible diagnosis or disease. I'll be discussing about this topic. So let's start from the beginning. So lab diagnostics or finding. Colonies of mucoid pseudomonas in lungs, that is cystic fibrosis. Colonies of mucoid pseudomonas in lungs, cystic fibrosis. Autosomal recessive mutation in CFTR gene, fat soluble vitamin deficiency and mucus plug. Colonies of mucoid pseudomonas in lungs, 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 cystic fibrosis. Diagnosis is cystic fibrosis. Autosomal recessive mutation in CFTR gene, fat soluble vitamin deficiency and mucus plugs. Decreased AFP in amniotic fluid or maternal serum, that is Downs or Edwards syndrome. Decreased AFP in amniotic fluid or maternal serum, that is Downs or Edwards syndrome. Decreased AFP in amniotic fluid or maternal serum. Decreased AFP in amniotic fluid or maternal serum, that is Edward or Down syndrome. Increased beta HCG, decreased PAPPA on first trimester screening. Increased beta HCG, decreased PAPPA in first trimester screening, that is Down syndrome. Increased serum homocysteine, increased methyl malonic acid, increased homocysteine, increased serum homocysteine, increased methyl malonic acid, decreased folate, it is vitamin B12 deficiency. Antihistamine antibodies, drug induced SLE, hydrolyzin, isoniazid, phenytoin, TNF alpha inhibitor. Decreased T cells, decreased PTH, decreased calcium, absent thymic shadow on chest X-ray, that is thymic aplasia, Degors's syndrome or velocardial facial syndrome. Let me repeat again from the fourth one. All right. So increased serum homocysteine, increased methyl malonic acid, and decreased folate. Increased methyl malonic acid, increased homocysteine, and decreased folate, that is vitamin B12 deficiency. Antihistamine antibodies, that is drug induced SLE, hydrolyzin, phenytoin, anti-TNF inhibitor, TNF alpha inhibitor, hydrolyzin, phenytoin, and isoniazid. The next one is decreased T cells, decreased PTS, decreased calcium. Decreased T cells, decreased PTS, decreased calcium, and on X-ray there is thymic aplasia, thymic shadow absent thymic shadow on chest X-ray, thymic aplasia, Degors's syndrome, verocardial facial syndrome. Large granules in phagocyte, immune deficiency. Large granules in phagocyte, immune deficiency. Celiac Higashi disease. Large granules in phagocytes, immune deficiency. Large granules in phagocytes, immune deficiency. Celiac Higashi disease. Congenital failure of phagolysosomes formation. Celiac Higashi disease. Recurrent infections, eczema, thrombocytopenia. Recurrent infection, eczema, Wiskott-Aldrich syndrome. Recurrent infection, eczema, and thrombocytopenia. Wiskott-Aldrich syndrome. Recurrent infections, eczema, thrombocytopenia. Optogen sensitivity, sensitive S pneumoniae, optogen sensitivity, sensitive and resistant. Okay, optogen sensitivity, there is sensitive and resistant. On sensitive there is S pneumoniae, and resistant there is Streptococcus viridans. S pneumoniae, Streptococcus viridans. sensitive S. pneumoniae, resistant S. Staphylococcus viridans. On viridans, there is Staphylococcus mutans and S. sanguis. S mutants S. sanguis. S mutants S. sanguis. Novobiosins response. Novobiosins response. Optogene sensitivity, novobiosins response, and bacillation response. Optogene sensitivity, novobiosins, and optogene sensitivity, novobiosins, optogene sensitivity, novobiosins, and optogene sensitivity, novobiosins, and bacillation. Optogene sensitivity, novobiosins, and bacillation response. Optogene sensitivity, there is sensitivity, there is S. pneumoniae, and resistant there is viridans. Streptococcus viridans. On examples are S. mutans and S. sanguis. Optogene sensitivity, and then there is bacillation. Bacillations. Before that, novobiosins. Let's talk about novobiosins response. Novobiosins response sensitive. Novobiosins S. epidermis and sensitive. Resistant is S. saprophyticus. S. epidermis, S. saprophyticus. Sensitive. Novobiosins sensitive. Novobiosins sensitive is S. epidermis. Novobiosins resistance is S. saprophyticus. Novobiosins response sensitive is S. epidermis and resistance is S. Staphylococcus saprophyticus. Novobiosins and bacillation. The last one, bacillation. The sensitive bacillation is S. pyogenes group A, that is S. pyogenes group A, and resistance S. agalactia group B. S. agalactia group B, that is resistance. Bacillation response sensitive S. pyogenes group A and S. and S. S. agalactia, agalactia, that is resistance group B. S. agalactia, that is bacillation response. So now let's talk about branching gram positive rods and with sulfur granules. Branching gram positive rods with sulfur granules. Branching gram positive rods with sulfur granules. There is Actinomyces israeli. Actinomyces israeli, that is S. Actinomyces israeli, that is branching gram positive rods with sulfur granules. Branching gram positive rods. Branching gram positive rods with sulfur granules. Branching gram positive rods with sulfur granules. Branching gram positive rod with sulfur granules. Branching gram positive rods 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 with sulfur granules, that is Israeli. Actinomyces israeli. Actinomyces israeli. Branching gram positive rods with sulfur granules. Okay, so hilar lymphadenopathy, peripheral granulomatous lesion in middle or lower lungs can calcify. Hilar lymphadenopathy, peripheral granulomatous lesion in the middle or lower lobes, that is Ghon's complex, that is primary TB Mycobacterium bacilli. Hilar lymphadenopathy, peripheral granulomatous lesion. Hilar lymphadenopathy, peripheral granulomatous lesion. Hilar lymphadenopathy, peripheral granulomatous lesion. Hilar lymphadenopathy, peripheral granulomatous lesion in the middle or lower lobes. Middle or lower lungs lobes. Middle or lower lungs lobes. Peripheral, not peripheral, it is a hilar lymphadenopathy. Hilar lymphadenopathy, hilar lymphadenopathy, peripheral granulomatous lesion in middle or lower lungs lobe. Hilar lymphadenopathy, peripheral granulomatous in middle or lower lungs lobe, that can calcify. There is Ghon's complex. There is Ghon's complex. There is Ghon complex. There is primary TB Mycobacterium bacilli. Thumb sign on lateral neck X-ray. Thumb sign on lateral neck of X-ray, that is epiglottitis, that is caused by H. influenza, Haemophilus influenza, epiglottitis. Thumb sign on lateral X-ray, neck X-ray. Bacteria covered vaginal epithelial cells. Bacteria covered vaginal epithelial cells, that is Kluysel's, Gardnerella vaginalis, Kluysel's, Gardnerella vaginalis, Kluysel's, Gardnerella vaginalis. Bacteria covered vaginal epithelial cells. Bacteria covered vaginal epithelial cells. Bacteria covered vaginal epithelial cells, that is Kluysel's. Dilated cardiomyopathy with apical atrophy. Dilated cardiomyopathy with apical atrophy, that is Chagas disease. Trypanosoma cruzi, Trypanosoma cruzi, Trypanosoma cruzi, Trypanosoma cruzi, Chagas disease, Trypanosoma cruzi, Chagas disease, dilated cardiomyopathy with apical atrophy, 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 that is Chagas disease, that is cruzi, Trypanosoma cruzi, Trypanosoma cruzi, Trypanosoma cruzi, Trypanosoma cruzi, Chagas disease, Trypanosoma cruzi, Chagas disease, dilated cardiomyopathy with apical atrophy. Typical lymphocytes and neutrophil antibodies. Typical lymphocytes and neutrophil antibodies. There is the next one. Typical lymphocytes and neutrophil antibodies. That is infectious mononucleosis Epstein-Barr virus infection. Infectious mononucleosis EBV infection. Epstein-Barr virus infections. Neutrophil antibodies. Typical lymphocytes. Typical lymphocytes with neutrophil antibodies, that is infectious mononucleosis. Atypical lymphocytes with neutrophilic antibodies. Atypical lymphocytes with neutrophilic antibodies, infectious mononucleosis. Eosinophilic intranuclear inclusion with perinuclear halo. Eosinophilic intranuclear inclusion with perinuclear halo. Eosinophilic intranuclear inclusion. Eosinophilic intranuclear inclusion with perinuclear halo. Cells infected with by herpes virus, herpes simplex, varicella zoster, and cytomegalovirus. So these three: herpes, varicella, cytomegalo. Eosinophilic intranuclear inclusion with perinuclear halo. 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 Eosinophilic intranuclear inclusion. Eosinophilic intranuclear inclusion with perinuclear halo. Stipple sign. The eosinophilic intranuclear with perinuclear halo. Eosinophilic intranuclear inclusion with perinuclear halo. Eosinophilic intranuclear inclusion with perinuclear halo. Cell infected by herpes virus. Cell infected by herpes virus. Cell infected by herpes virus. Eosinophilic inclusion with perinuclear halo. Eosinophilic intranuclear 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 inclusion with perinuclear halo, that is herpes virus. Cell infected by herpes simplex, herpes varicella zoster, and cytomegalovirus. Stipple sign on frontal chest X-ray. Stipple sign on frontal chest X-ray, that is group parainfluenza virus, that is group. Stipple sign on frontal chest X-ray, that is group parainfluenza virus group parainfluenza virus. Stipple sign on frontal chest X-ray. Eosinophilic inclusion body in cytoplasm. Eosinophilic inclusion body in cytoplasm of hippocampal and cerebellar neurons. Eosinophilic inclusion bodies in cytoplasm of hippocampal and cerebellar neurons. Negri bodies of rabies. Eosinophilic inclusion body in the cytoplasm of hippocampal and cerebellar neurons. Eosinophilic inclusion body in the cytoplasm of hippocampal and cerebellar neurons. Eosinophilic inclusion body in the cytoplasm of hippocampal and cerebellar neurons. Eosinophilic inclusion body in cytoplasm of hippocampal and cerebellar neurons. Eosinophilic inclusion body in the cytoplasm of hippocampal and cerebellar neurons, that is Negri bodies of rabies. Eosinophilic inclusion body in cytoplasm of hippocampal and cerebellar neurons. So next one is ring enhancing brain lesion on CT MRI in AIDS. Ring enhancing brain lesion on CT scan or MRI in AIDS, that is Toxoplasma gondii or CNS lymphoma. Toxoplasma gondii or CNS lymphoma. Ring enhancing lesion in cytoplasm. Ring enhancing lesion in brain. Ring enhancing brain lesion on CT or MRI in AIDS patient, Toxoplasma gondii or CNS lymphoma. Samama bodies. That is seen in Samama bodies is seen in meningioma, papillary thyroid carcinoma, mesothelioma, papillary thyroid carcinoma, meningioma, papillary thyroid carcinoma, meningioma, papillary thyroid carcinoma, mesothelioma, papillary serous carcinoma of endometrium and ovary, papillary serous carcinoma of endometrium and ovary, papillary thyroid carcinoma, mesothelioma, papillary thyroid carcinoma, meningioma. Some bodies are present in meningioma, papillary thyroid carcinoma, and mesothelioma, papillary serous carcinoma of endometrium and ovary, papillary serous, both papillary thyroid carcinoma and papillary serous carcinoma of ovary and endometrium, meningioma and mesothelioma of lungs, mesothelioma and papillary serous carcinoma of endometrium and ovary, papillary thyroid carcinoma, and papillary serous carcinoma of endometrium and ovary. Papillary serous carcinoma of endometrium and ovary, meningioma, and mesothelioma is for some bodies. Ring enhancing brain lesion on CT MRI in AIDS, that is toxoplasma gondii or CNS tumor. Eosinophilic inclusion bodies in cytoplasm of hippocampal and cerebellar neurons. Eosinophilic inclusion of body eosinophilic inclusion bodies in cytoplasm of hippocampal and cerebellar neurons, that is negri body of rabies. Stable sign on frontal X-ray, that is group parainfluenza virus, that is easier one. Eosinophilic intranuclear inclusion with perinuclear halo. Eosinophilic intranuclear inclusion with perinuclear halo, cell infected by herpes. Eosinophilic intranuclear inclusion with perinuclear halo, there is cell infected by herpes. Atypical lymphocyte heterophilic antibodies. Atypical lymphocyte heterophilic antibodies. Atypical lymphocyte heterophilic antibodies. Atypical lymphocyte heterophil antibodies. Infectious mononucleosis. Dilated cardiomyopathy with apical atrophy. Dilated cardiomyopathy with apical atrophy, that is Chagas disease. Trypanosoma cruzi, Chagas disease. Dilated cardiomyopathy with apical atrophy, Chagas disease or Trypanosoma cruzi. Bacterial covered vaginal epithelial cells. Bacteria covered vaginal epithelial cells, that is Klusiella Gardnerella vaginalis. Bacteria covered vaginal epithelial cells, that is Klusiella Gardnerella vaginalis. Thomson and lateral neck X-ray, that is epiglottitis, hemophilus influenza. Hiral lymphadenopathy, peripheral granulomatous lesion in middle or lower lungs lobe, which can calcify. Hiral lymphadenopathy, peripheral granulomatous lesion in middle or lower lobes, that is Ghon's complex. Primary TB, Mycobacterium bacilli. Branching gram-positive rod with sulfur granules. Branching gram-positive rods with sulfur granules, that is Actinomyces israeli. Actinomyces israeli. Branching gram-positive rods with sulfur granules, that is Actinomyces israeli. Bacillation response, novobiocin response, and optogen sensitivity. These three reactions, sensitivity, response, there is sensitivity and resistance. For bacillation response, there is Streptococcus pyogenes, that is the group A, and for the sensitive, there is bacillation response sensitive, that is Streptococcus pyogenes group A, and for resistance there is Streptococcus egalatia, that is group B. Novobiocin response, for novobiocin response there is, for sensitive there is Streptococcus epidermidis, and resistance there is Streptococcus saprophyticus. Optogen sensitivity, sensitive Streptococcus pneumoniae, and for resistance viridans Streptococcus viridans, that is resistance for optogen sensitivity, and Streptococcus mutans and sanguis, these are for resistance. So recurrent infections, eczema, thrombocytopenia, that is Wiskott-Aldrich syndrome. Recurrent infections, eczema, thrombocytopenia, Wiskott-Aldrich syndrome. Large granules in phagocytes, immunodeficiency. Large granules in phagocytes, immunodeficiency, that is celiac higacy disease. Congenital failure of phagolysosomes formation. Congenital failure of phagolysosomes formation. Celiac higacy disease. Large granules in phagocytes, immunodeficiency. Decreased T cells, decreased PTH, decreased calcium absent thymic shadow on chest X-ray. Decreased T cells, decreased PTH, decreased calcium absent thymic shadow on chest X-ray, that is thymic aplasia, Dickloch syndrome, Belocardial facial syndrome. Anti-histamine antibodies, drug-induced SLE. Hydrolyzin isoniazid phenytoin TNF alpha inhibitor. Hydrolyzin isoniazid phenytoin and TNF alpha inhibitor. Hydrolyzin isoniazid phenytoin TNF alpha inhibitors. These are drug-induced SLE, anti-histamine antibodies. The next one is increased serum homocysteine, increased methyl malonic acid, increased homocysteine, increased methyl malonic acid, decreased folate. This is vitamin B12 deficiency. Increased homocysteine, increased methyl malonic acid, decreased folate. There is vitamin B12 deficiency. Increased beta HCG, decreased PAPPA on first trimester screening, that is Down syndrome. Increased beta HCG, decreased PAPPA on first trimester screening, that is Down syndrome. Decreased AFP in amniotic fluid or maternal serum. Decreased AFP in amniotic fluid or maternal serum, that is Downs or Edwards syndrome. Colonies of mucoid pseudomonas in lungs. Colonies of mucoid pseudomonas in lungs, that is cystic fibrosis. Autosomal recessive mutants in CFTR genes. Autosomal recessive mutation in CFTR genes, that is fat soluble vitamins deficiency and mucus plug. Fat soluble vitamin deficiency and mucus plugs. Okay, these all are the classical findings and labs findings. This is the first page. So in the next video I'll be talking about the other features of lab diagnostic findings and disease or diagnosis. Thank you.